Good afternoon. My name is Sarah Weiner, Program Manager of Education and Practice at the Association of Schools and Programs of Public Health. Thank you for joining us for today's ASPPH Presents Webinar, The Future Public Health Workforce, Pipelines and Profiles of SOPHAS Applicants, as we get an in-depth look at the SOPHAS applicant pool, including 9-year trends and a detailed look at the academic and demographic profiles of the most recent application cycle. Today's webinar will be 1 hour in length and will include question and answer period at the end. This webinar is part of the 2016 ASPPH Presents Monthly Series, which has been designed as a service to CEPH-accredited ASPPH member schools and programs of public health. The webinar is being recorded and it will be available along with the slides on the ASPPH website in the Archived Webinar section soon. Additionally, this webinar has been approved for 1 hour of CPH continuing education credit. A few housekeeping items of note. While you are in listen-only mode and your lines have been muted, we encourage you to ask questions throughout the presentation by using the question box. We will address your questions at the end of the presentation. I am pleased to introduce today's speakers. Allison Foster is the ASPPH Deputy Executive Director and has worked for the association for over 20 years. Guy Petrowski is the ASPPH Manager of Centralized Application Services and formerly worked in admissions at the University of Minnesota School of Public Health. And Emily Burke is the Manager of Data Analytics at ASPPH. Emily oversees annual data collection and analytics for the ASPPH Data Center member portal and supports a number of academic public health data projects for the ASPPH Data Center. Thank you, Allison, Guy, and Emily. I'll now turn it over to you.
Thank you, Sarah. So this webinar will present data collected through the SOPHAS Application Service. Launched in 2007, SOPHAS provides applicants to schools and programs of public health with a common application system while providing the SOPHAS institutions with an easier way to accept and track applications and to make enrollment offers. In the past 9 years, SOPHAS has processed applications from more than 110,000 applicants. This webinar will focus on the 2014-2015 application cycle while also providing some trends data. First, we'd like to provide a bit of background about how SOPHAS works, which will provide context for the rest of the presentation. SOPHAS is a member service of ASPPH. There are two very important partners in the SOPHAS process. The first is Liaison International, an information technology firm located in Boston, Massachusetts, which manages the software as well as the customer service. Liaison has over 20 years experience with centralized application services and hosts nearly 30 other application services for other health professions. The other very important partner are participating schools and programs which essentially govern how SOPHAS works. ASPPH members participating in SOPHAS decide which, if not all, of their degree programs participate. However, for the degree programs which are included in SOPHAS, all applicants must apply through SOPHAS. No exceptions are allowed. As the name Centralized Application Service implies, applications complete a common application, allowing them to efficiently apply to more than one institution at a time. We strive to reduce the burden on students by eliminating redundancies in data entry and documentation. However, it is important that member programs have access to the information that they need for their individual programs. SOPHAS allows members to customize the documents which are collected, as well as for schools and programs to ask subsets of questions that are unique to their particular institution. As you can see, the number of applicants has tripled since launching in 2007. The number of SOPHAS institutions also mirrors that increase. One thing to note, in 2013, ASPPH membership expanded to include programs of public health, which really explains the jump in SOPHAS institutions in 2014. During the application cycle 2014-2015, 80 ASPPH member schools and programs were participating in SOPHAS, which you can see were located across the U.S. as well as Canada and Grenada. These are the schools and programs to which applicants that we'll be looking at during the next section applied. Emily, I'd like to ask you, walk us through the application pool next.
Great, I'd be happy to. And as Allison mentioned earlier, the majority of the slides present data from the 2015 SOPHAS Applicant Analysis. And the first two slides will show you some trends around gender and citizenship. And here you can see that not much has changed since 2007. Though our SOPHAS applicant numbers have increased dramatically, the gender ratio has remained fairly constant around at 29% men and 71% women. The percentage of applicants from foreign nations dipped to around 20% in 2010 and has slowly been recovering since. In 2015, almost a quarter of applicants were international citizens. And here is something interesting to note. Of the almost 14,000 applicants from the U.S., about 25% are men. However, close to 40% of the approximately 4,400 international applications are men. Here you can see that 76.8% of all applicants are between the ages of 20 and 29. The average age of both U.S. and international applicants is 27. However, you can see that the international applicant tends to be a bit older than the U.S. applicant. This is despite the fact that the age range is much broader for U.S. citizens, with ages ranging from 17 to 73. The age range for those international applicants is 16 to 60. And here you're looking at a listing of the top 10 states of 2015 U.S. applicants. And you can see that most applicants reside in a state with more than one SOPHAS institution. And clearly the top state is California, and they have 7 SOPHAS member institutions. And now you're taking a look at the top 10 countries of citizenship of the 2015 international applicants. China consistently ranks as the country with the most applicants when we exclude the U.S. They had 1,048 applicants in 2015. In 2015, underrepresented minorities made up 26% of the 2015 applicant pool. White applicants make up a little less than half of applicants, and this racial ethnic makeup has remained fairly consistent across the 9 years of SOPHAS applications. 43.6% of all 2015 U.S. applicants were first-generation graduate degree seekers. This percentage is a slight increase from the year before, which stood at 41%. And our Hispanic Latino applicants are the most likely to be a first-generation applicant at 62%. And now I'll hand it over to Guy to finish up with our academic profile.
Okay, thanks, Emily. Okay, on the left, you are looking at the top 10 undergraduate majors of applicants that graduated from a U.S. institution. And on the right, you're looking at the top 10 undergraduate majors of applicants that graduated from a foreign institution. Biology, public health, biological sciences, and nursing are top ranking for both domestic and international institutions. The social sciences are well represented at the top 10 at U.S. institutions. All 10 majors at international institutions are health-related hard sciences. All of the top U.S. feeder institutions of 2015 applicants, all of the universities do house a School of Public Health. These top 10 institutions make up 15% of all applicants. You are looking at the number of earned degrees. This does not include the 4,693 students expecting degrees. The percentage of applicants that have earned master's and doctoral degrees increased in 2015. The increase in doctoral level degrees is attributable to MDs seeking public health degrees. You'll notice the MPH makes up 43% of all those earned master's degrees on the previous slide. The average GPA of all applicants is 3.38, which is just above the average GPA for all earned undergraduate degrees. You can see that the average GPA for degrees in biological sciences is about 3.1, while the average GPA for degrees in social sciences is 3.5. As one might expect, the GPA goes up as the level of earned degree goes up. You can see the years since degree completion for 2015 applicants. The average number of years between degree completion and applying for School of Public Health is 2.3. The range is 0 to 57 years, and the median is 0 years. Most applicants apply immediately after earning their previous degree. A few other high-ranking introductions to public health from, as you can see here, are public health advisors and guidance counselors, graduate school fairs, healthcare providers, and parents. But the greatest is internet and website. Now I'm going to give you a look at the matriculant profile. As you can see here, of the more than 18,000 applications during 2014-2015, 12,610 of those were offered admission, which is, 69%. Of those applicants, they applied to the average of 3 institutions, and of the 12,610, 8,818 actually enrolled in a school or program of public health, which is 70% of those admitted. And now, Sarah, I'm going to hand it back over to you.
Thank you, Guy, and thank you, Allison, Guy, and Emily. We'll now take this time to address questions from the question box. Please feel free to type your questions in the chat box at this time. What was the average GRE score from applicants?
Sure, I'll take that one. This is Emily Burke from the ASPPH Data Center. I don't have that on hand right now, but I would be happy to share that information. It is included in the 2015 applicant analysis, and if you send an email to data@aspph.org, we can share that information.
Great, thank you. Are you seeing a trend in the 2016 cycle of the desired MPH concentration?
I'll take that one again. In 2015, the most likely concentration of our matriculants was epidemiology when applying for the MPH.
All right. Would you know the percent of underrepresented students who are enrolled in MPH programs versus PhD programs, etc.?
That's an analysis that we can run, yes. Please send an email to data@asppph.org.
All right, great. This is another question. Do you have applicant trends by program and degree? Some of our programs are doing well and others are not.
That's another yes.
Okay, so they should send an email to
data@asppph.org, please.
Do we have any information on the pre and post jobs of applicants?
Yes, the application requires that applicants submit information on their employment, including their resume. However, we will begin to track some graduate outcomes in the upcoming year for our graduates.
All right. How much emphasis do admissions personnel place on GRE test scores? How much on GPA?
I can answer that. It really does vary from school to school. I do know that the majority of schools do a holistic review of applications, but again, it really is school specific. It's really hard to get that information out.
Great, thank you guys. I think this one might be another one for data@asppph.org, but I'll toss it out there. Would you know the percentage or the demographic breakdown of those who are in the top major, epidemiology?
Absolutely, we can certainly provide that information.
Great. All right, here's another one. Are there plans or special initiatives to support increasing the number or percentage of URM applying to schools of public health, which in turn would help increase the diversity of member schools, since there hasn't been an increase in over 9 years?
I can take that one. So we do have a significant recruiting initiative, and one of our goals there is to make sure that we try to increase the number of applicants from diverse backgrounds. So we're always looking to exhibit and opportunities to outreach where we can. We also have a fee waiver program in place for applicants, and part of the reason for the fee waiver program is to make sure the application fees are not a barrier. So with those two initiatives in place, we hope that we can try to turn the tide a bit and increase the number of applicants from diverse backgrounds.
If most MPH applicants learn about the program online, is there data on which websites they are using to find out about MPH programs?
I don't think we can track that.
Correct. ASPPH is able to track hits to our own website. However, we are not tracking other websites that applicants are using to learn more about public health.
Also, we can track the actual SOPHAS website. In addition to ASPPH, we can track the hits on that particular site in program searches. So we would have that data.
Right, thank you. How come the average GPA for biological sciences is lower than that for social sciences? Do most universities think that social sciences is easier than biological sciences?
This is speculation on my part. We can look at the coursework that students are completing prior to applying, and I would imagine that some of those hard sciences classes, including organic chemistry, are probably more difficult to pass than some of those social sciences courses. But we have to take a much more in-depth look to figure out what's causing those dips in GPA.
Do we have any Do we have any information on financial assistance needs or requests of applicants at all levels by domestic and global or international?
We do have a series of questions in the applications, whether the applicants are interested in financial aid or financial assistance. But we don't specifically ask what they're looking for other than those two questions. But we do have a website or a web page on the SOPHAS site and the ASPPH website, Financing Your Degree, and it's a pretty robust database of scholarship and financial aid opportunities. So we could look at the traffic there and see what individuals are looking for and what they're clicking to. So they're categorized by merit, by background, what type of aid is it. So that's something we could look into further to see what types of aid are applicants looking for.
Thank you, Allison. Have you looked at predictors of graduation other than GRE and GPA? What are good predictors of successful completion of the program? We have made the experience, especially for adults in workforce, that GPA is not a good predictor. We've had that.
Well, one of our goals is to actually, we're calling it predictors of success, is to look at some of the factors. So we're pulling outcomes from our participating schools and programs, and we do want to map that against a number of years of work experience, all kinds of academic backgrounds. So that's something that we're hoping that we will be able to take a look at and to share sometime in the near future. And it sounds like if our members are doing the same thing, that might be a good joint project to do together.
Great. Do you know how many schools require a WES evaluation for international applicants versus conducting an internal foreign transcript evaluation, for example, through a Center for International Education?
I can answer that. I would say all of the schools will accept the WES evaluation for review of the application. Some schools who have close ties to their graduate schools, they will still require documents be sent to the individual schools, but I would say, just off the top of my head, about 80% of the schools are now requiring WES as a part of the application. I might be slightly off on that, but that's what's in the top of my head, 80%.
All right, thanks, Guy.
Mm-hmm.
Do you know what percent of graduates? I'm sorry. Do you know what percent of graduates of bachelor's public health degrees go on to obtain an MPH?
I don't know the exact number off the top of my head, but I will say that it's surprisingly low at this point, in under 10%.
Would you please discuss some of the pipelines of SOPHAS applicants?
Pipeline to the workforce, I'm assuming. If that is what you're asking, we do not have information on that right now, on the workforce pipeline. However, we will be collecting that information moving forward.
Okay. Do we track indebtedness of graduates of MPH, MS, PhD?
And again, that's another data element we will be collecting in our 2015 annual data collection, 2016 annual data collection.
Great. It looks like we have another question. It seems that the trend has changed. More applicants are going into MPH programs immediately after the undergraduate experience. Can you discuss your thoughts on why the change in the trend and the benefits and the challenges and benefits of the trend?
Guy, since you're the only one on the panel from an admissions office, do you want to speculate?
Sure. Yeah. I think that you're finding more and more, when I was at the University of Minnesota, while there was not a public health major, there was a very active public health minor and a student group in public health. I think that at some of the larger universities that have public health, students are becoming aware of public health much earlier, which would then, I think, explain some of the reason why you're getting them applying to programs right after they're through with school. Also, I do know such programs such as the Harvard School of Public Health. It used to be that you did have to have an MD or higher level degree to go into the MPH, and that is not the case anymore. So that's happening at a number of universities as well. Whether it's good or not, I can't answer that.
All right. It looks like we might not have any other additional questions. We'll leave it open for just a few more, another moment or so. Emily, did you have an announcement?
Sure, and I want to take this opportunity to promote a new benefit that is featured on the SOPHAS designation portal, to which all SOPHAS members institutions have access. There are 2 new data dashboards which are interactive. You can pull information about your matriculants, and you can pull information about the applicants, and I encourage you to use these. And as always, please contact the data center if you have any questions, if you need assistance in using them. We're happy to help. And again, that email is data@asppph.org. I know you've heard me say it. I sound like a broken record, but please don't hesitate to call or contact.
And just to add to that, if you need access to the designations portal, just please contact your main SOPHAS contact at your school in the admissions office, and they can get you access to that.
Wonderful. Seeing no more questions at this time, thank you, Allison, Guy, and Emily for presenting today, and thanks to all of you for joining the webinar. As a reminder, the webinar was recorded and it will be made available on the ASPPH website in the archived webinar section soon, along with a PDF of the slides. And please be sure to contact us with any additional questions and to register for the next webinars in the ASPPH Presents series. Additionally, please save the date for the 2017 ASPPH Annual Meeting and the 2017 Undergraduate Public Health and Global Health Education Summit to be held in Arlington, Virginia. And lastly, please note that registration will be opening in July for the 2016 ACSA ASPPH Fall Conference, the first ever joint conference between the Association of Collegiate Schools of Architecture and the Association of Schools and Programs of Public Health. It will connect academics, practitioners, and policymakers who are exploring issues at the intersection of design, the built environment, and public health at all scales, from materials to buildings to landscapes to urban and social systems. Thank you. This webinar is now adjourned.